Good day to you all. My name is Nr Shazali Yau Mani, and in today's presentation, I'm going to talk about who is a patient. Patient, by definition, patient is any individual who seeks medical care or attention for their health need. A patient can include individuals who are undergoing medical diagnosis or treatment in the hospital or outside the hospital, or those people who are seeking for preventive care, or those who require mental health or emotional support. These are patients. Then the word patient itself, when you take the abbreviation of the word patient, what does it mean? P stands for prepared, meaning the patient are those people who need to be prepared for treatment and recovery. The A stands for aware, meaning the patient needs to be aware of their conditions and options, that is treatment options. Then the T stands for trusting. That is, the patient need to be trusting in the healthcare team. The healthcare team should be available and should be accommodating to the extent that the patient trusts them. Then the patients also need to be informed about their diagnosis, their disease, and their treatment. The E stands for engaged. Patients need to always be engaged in their care. When you engage the patient in their own care and recovery, the whole process now becomes simplified. N in the patient stand for nurtured, meaning the patient need to be nurtured physically, emotionally, and mentally as well. Finally, patients need to always be treated with respect, treated with dignity, and treated with compassion. Types of patients. Patients are of various types, are not all the same. They all come with various needs in the hospital. There are those that are called inpatient, who are on admission usually in the wards, taking or receiving care for some number of days. And there are those that we call outpatients, who are usually seen in the outpatient department. They come with cases that need to be treated on the day and be discharged home. There are patients that we call emergency patients. These are patients with utmost need, those who need urgent and emergent care, those who need minimal delay, usually because they come with life-threatening condition. There are patients that are chronic patients, usually those with chronic disease that develop over a period of time, like chronic obstructive pulmonary diseases like diabetes mellitus, diseases like hypertension, diseases like cancer, and many more. Then we have those that are pediatric patients, usually belonging to the group of children, those who are under the age of 12 usually. We have elderly that are mostly more than 60 years of age, and they come with conditions that are related to degenerative changes or diseases of the elderly. There are maternity patients, those that have various conditions in obstetric and gynecology, those that has to do with maternity section. Then we have surgical patients, usually come with surgical conditions that need to be or to undergo surgery. Mental health patients are those that have specific need in relation to the mental health, in relation to the issues that has to do with the brain, the psychology, the emotion, and everything that has to do with the mental health or psychiatric patient. And we have patients who are disabled, those who are patient as a result of being disabled, losing some aspect of their physical ability, and many more. We have so many other types. These are just a few examples of the patient. Characteristics of a patient. Patients always come with their needs. You need to always know that the patient comes with their needs. These needs can be physical, they can be emotional, or they can be psychological need, and you need to attend them as healthcare professional. The patient also have right to access their care, right to privacy, and right to informed consent. Whatever you do to the patient, you need to respect their right. The patients have another characteristic of vulnerability, meaning they are vulnerable. They depend on healthcare providers for treatment and guidance. Since they depend on you, therefore you need to also treat them with compassion. Then diversity. Patients come from all walks of life with varying condition and cultural background. Not all patients are the same. Not all are coming with the same condition. Not all the patients are coming from the same background of economic or cultural background. So all of them are different and need to be treated differently. The patient healthcare relationship is such a relationship in which you need to understand that the patient relies on trust in healthcare providers, clear communication for informed decision, compassionate and professional care, as well as sympathy and empathy, among others. All this need to be integrated in care of our patients. The role of a patient in healthcare system. You need to understand that it's not only the healthcare providers that play a vital role in the healthcare system, because without patient there will be no need for any healthcare provider. Therefore, the healthcare provider need to understand that patients are very, very important and have very vital role they play. This includes adherence to treatment, that is following prescribed therapies. The patient need to understand that there is need for informed decision. Whatever you are going to do to the patient, you need to make the patient understand the option and the risk of that condition and let him decide on accepting or rejecting. Feedback, sharing experience to improve care. We always ask our patients to give feedback of the treatment or come back for follow-up care, that is to get a feedback on whether the treatment instituted on them has really worked or not. Self-advocacy, that the patient need to be asking questions and voicing their concern to the healthcare providers. On the other hand, the healthcare providers need to be listening and need to be responsive in that nature. The evolving definition of patient. In the past, patients are being looked at as passive recipients of care, but in the present time, the patients are those who actively participate in their health journey, meaning that now the definition is different from before. Then in the future also, patients will be considered as collaborators in personalized and technologically driven care, meaning in near future, when a patient comes, the patient is not solely dependent on the healthcare professional. He needs to collaborate. It is a collaborative work, especially as it is technologically driven. Patients come to the hospital already prepared. Summary and conclusion. Patients are the heart of healthcare system, because without them, nobody will be there in the hospital or in any healthcare facility. They encompass diverse needs and roles, as we identify that they come with different and various needs. Building trust and collaboration is therefore crucial for effective care. The definition continues to evolve with advance in health care. As healthcare providers, we need to understand that not all the patients usually have patience, but we need patience in dealing with our patients. Thank you very much. This is the short presentation on who is a patient. Give us your contribution, your comments, and your subscription. Thank you very much. Till we meet next.